Hello everyone, this is Chadi Alraies from CVI 2022 in Denver, Colorado. I'm really privileged to be with Dr. Heba Osman. She is a Chief Resident at Ped and Adult Program at Wayne State University. Heba, thanks for being with us.
Nice to meet you, Dr. Alraies.
Yeah, Heba, so this is your first time at CVI.
Yeah.
And as a trainee, which is I think really good, but it's important to be early in interventional setting. You're presenting a very interesting case that's going to be presented later today. Let's walk through the case with you.
So we had a 60-year-old patient that came in with a history of multiple GI bleeds. She had already had mechanical bileaflet mitral valve in place, so she required lifelong warfarin. And because of the lifelong warfarin, she had kept coming in with multiple GI bleeds.
Good.
We ultimately offered her a biprosthetic valve. She refused because she's a high-risk surgical candidate. But the question is, there's no really literature or guidance on the use of mechanical versus biprosthetic valves. ESRD patients, which she is on dialysis, do have an attenuated survival.
Yeah.
And so the question should be, do we really need to put them on a mechanical valve with a high risk of bleeding on anticoagulation, or do a bioprosthetic valve? And we know they have attenuated survival. And then ultimately, if they do live longer, we can do a valve-in-valve procedure and replace the valve.
So this is a kind of a tough conversation with the patient. How old was she?
She was 60.
60.
Yeah.
And so this requires sternotomy or replacing the whole valve.
Yeah.
So how was the dynamic with the patient?
So it was very difficult, but she was very aware of her surgical risk score, and I think that was ultimately the deciding factor as to why she didn't want to proceed.
Yeah.
She would rather have taken the risk of multiple admissions with GI bleeds and AVMs and
Over sternotomy.
Sternotomy and the risk of death.
Then GI didn't discover why she's bleeding?
No, they had found a duodenal lesion and that required clipping. But she kept coming in with multiple sources of bleeding, whether it was like different sources of GI bleeding or AVMs.
AVMs or something, which is hard. Yeah. Well, so how did the case end, or what was the?
She left, and when I was chart reviewing her later, I found out she came back in again with another GI bleed. She continues to follow with her cardiologist. She is aware of the risks of both. The anticoagulation versus a repeat procedure, and she's willing to take the risk, and ultimately, she has the autonomy to do so.
Absolutely. So what is the time between the surgery of the valve and starting bleeding?
So she got the valve in 2020.
Oh, it's recent.
And almost immediately, I believe under a year, she started to have multiple bleeds. Yeah.
So,
and she didn't. I checked her history. I couldn't find any history of bleeding.
So never guess that she's gonna bleed once you put her. Yeah.
She had full hemolytic workup was negative, so she ultimately needed to be off the warfarin.
So why was it something hemodynamically in the valve that posed her at risk for AVMs?
Honestly, I don't think we found anything. I'm not sure.
Yeah. So as you know, with the aortic valve stenosis, there's Heide syndrome and AVMs, but this is unusual. Yeah. So just maybe the warfarin itself.
Yeah.
So aortic valve, and would you shoot for a lower INR in these cases?
I actually don't. That's a good question. I would assume you would know the answer.
Usually it's a high flow valve, and you have a normal ejection fraction.
Yeah.
You can argue you can take her off even. Some people take her off.
Well, for her it was mitral, sorry.
Oh, mitral.
Yeah, it was mitral.
So no question. She has to be.
Yes, yeah.
Now, first time at CVI, first time in Denver. What do you think about the meeting?
I love Denver. I went to Rocky Mountains yesterday. And the conference has been very informative. Obviously, I'm a resident, so a lot of it is advanced.
Sure.
But it's amazing to just be surrounding all these experts in the field and to be aware of what's new and what's upcoming, and kind of seeing the shift in advancements in technology and everything.
Right. Yeah. And especially for somebody now, you can see the flavor of what the future will be.
Yes.
But being at the beginning of the process, I think is very important. And good exposure as well.
Yes.
Heba, thanks for being with us. Really appreciate your time. Please watch the videos and others on CVI YouTube channel. This is Chadi Alraies from Denver, Colorado. Heba, thanks again.
Thank you.